imagine that I would start this with a question about aftercare. Does anyone have any idea how much time you spend during the day as a provider with aftercare? Any idea? So studies show it's an hour and a half per provider per day. Now, if I could get you half of that back, would that be worth something to you? To get 45 minutes a day back. That adds up to about 200 hours a year. So before I go into how we do that, I want you all to think back to the last time you went to an outpatient procedure and what happened when you left. What did they give you? Probably a piece of paper, right? And then you took that paper home. You probably forgot what the doctor told you, possibly because you were on some influence of some painkiller, possibly because there was a lot happening. Maybe you were relying on a family friend to tell you. Aftercare is an important part of the recovery procedure, as you all know, and most of the time, it's given to patients on their own recognizance to figure out what's supposed to be done. I personally believe that patient education is a fundamental human right. The reason why I believe that and why I started this company is I've been in CRM for 25 years, customer relationship management. I decided to change our company's focus because my mom passed away from leukemia. And when she left the hospital, they gave her a piece of paper. And I think that we can do better. Actually, I know we can do better. And that's why I started my company. Because I believe that if we guide people through aftercare, it makes a difference to the patients. And as it turns out, it makes a difference to the providers too. So you're all providers, and you understand the word efficacy is really what drives whether or not you do something in your practice. So I'm gonna throw some numbers out at you. 30% uplift from patients reporting how much better their aftercare is when they go through guided aftercare. Now the difference between guided and unguided, guided means for the first week you're getting some method of communication. Something tells you this is what's normal, this is what you should expect, this is abnormal. So when a patient has guided aftercare, you've got 30% better health, which of course makes them happier and all of that. The other side of that is that you have 40% fewer calls back to your office. Now I'm fairly certain most of you have fielded calls from your patients who've been asking you questions of things that they probably could have figured out on their own, or maybe they went to Google on their own. And they're freaking out because they don't have the information that they need to make an educated decision about their health, and so they call you. So what we want to do is address that. When we do, patients know what to ask when they call you, so they're not wasting your time. There happens to be other knock-on benefits from this too, because as you get better educated patients, it shows that you've got better outcomes, which means fewer complications, which means less malpractice. 53% of all malpractice lawsuits involve communication failure between the provider and the patient. We address that through our technology. So that's why I built what we built. So rather than trusting the piece of paper and the memory of a patient, we guide them through the aftercare journey. They get text messages that are curated and personalized. So if someone has bruxism, diabetes, they're immunocompromised, those messages and the timing of them change because their comorbidities impact how their aftercare works. So not only are we addressing malpractice, we're reducing your loss claims because you've got fewer patients that are making claims against insurance due to complications. What we've built is truly a win-win for the patient, for the practice, and for everyone in this room. So if this is something that you would like to learn more about, I would love to learn how to help you as well. And I encourage you to stop by, and we'd love to talk to you more about how we can help your practice and help you personally. So thank you very much for your time.
Thank you.